face on Zoom. You can add that in as well as your title and your organization. Great. Can you guys still see my PowerPoint? Okay, great. All right, so as we get started, my name is Megan Levitt and I work for Carleton County Public Health and Human Services, but I also do some regional breastfeeding support through Healthy Northland and the Statewide Health Improvement Partnership. So glad you can all be here today and give some of your time to learning more about breastfeeding in our region, and actually across the state. We'll have some really great updates coming up throughout the day. So as we get started today, just a reminder to please mute your line when you're not speaking. We're gonna aim to use the Q&A feature. I'm actually not seeing it on my end. So if you have questions, if you're able to use the Q&A feature, otherwise just stick them in the chat. We're gonna be monitoring that. We'll get back to you through that. The slides are going to be available and emailed out to all of the participants following the summit. So watch for those. The email for that will be coming from Yodi, and she's with the Carleton Cook Lake St. Louis Community Health Board. So she will be sending out the email with the slides as well as the evaluation link. You will also get a link to the evaluation and the post-test questions here today at the end of the summit in the chat. So you'll be able to access it right away, but you will also get it in that follow-up email in case you miss it here today. You will also get an email from Yodi after you complete your evaluation. You'll get that email from Yodi with your certificate. So watch for those 2 emails from her. And then just a thank you for Healthy Northland for funding the mailing and this work that we're doing, the summit today. You should have received, hopefully the mail service was quick enough to get you a mailing. It was sent out last week with a magnet for human milk storage. You got a door hanger for a mother's room, and then you also received a window cling to use, and then the agenda for today. All right, as we continue on here, we're gonna do a land acknowledgement. The art credit goes to Larissa Greensky with Fond du Lac. So actually Naomi Defoe, one of our panelists, is unable to be here today, but that's her sister who does this beautiful artwork. So thank you to her for sharing that with us today. Healthy Northland acknowledges that we're holding this virtual summit on the traditional, ancestral, and present-day home of Indigenous communities. The beautiful land we all love is the stolen land of the Ojibwe, in some contexts the Anishinaabe or Chippewa, and the Dakota, and in some contexts Lakota or Sioux. Today there are 7 Ojibwe reservations and 4 Dakota tribal communities in Minnesota. For the majority of the thousands of years Native families have lived on this land, babies thrived on their mother's milk. Colonization, violence, and forced family separation has attempted to destroy the legacy of breastfeeding within these communities. Healthy Northland is honored and privileged to work alongside many Indigenous and non-Indigenous lactation professionals and advocates to reclaim breastfeeding as food sovereignty. And then if for some reason you did not get a copy of the agenda today, here is a quick overview of what we'll be going through today. I know it's a busy slide, but we're in the welcome now. We'll jump into panel updates from 6 regional folks, and we'll actually have a little bit of time to do some questions for those panelists specifically before we jump into open updates. We'll have some square table breakout rooms, time to network and discuss a few shared questions, a little bit of a break, and then we'll have Carrie, our main speaker, sharing in kind of the second half of the morning. So just wanted to cover a few things. Our speakers have no conflicts of interest. This presentation is not supported by any funds from companies that violate the International Code of Marketing of Breast Milk Substitutes.
Megan, the slides aren't advancing at all.
Oh, okay. Let me try
it's still
and
on the first slide.
Oh, bummer. Okay, let me reshare my screen. Right. Well, I might have to try and pull it back up here. Sure, this relationship beholds. So why don't you go ahead, Michelle? Thanks for being here.
Thank you, Megan. I did try to share my slide, however, it says that I'm not able to.
If you want to try again, it says you're one of the co-hosts now, so you should be able to. So try again. If it doesn't work, let us know.
Okay, perfect. That is not what I want to share with you guys. Okay. Oops, not now. My goodness, let's see if I can do a full screen on this. That'll be nicer to see. Let's see. Okay, I'm going to leave it here so we can get started. Can you see, it should say regional nurse home visiting. Okay, thank you. I'm seeing some head shaking. So good morning. Yes, hello everybody. My name is Michelle Janowick, and as Megan said, I am a nurse home visitor with Carleton County. I recently moved into the nurse specialist position. Many of you probably knew my predecessor, Jenny Jorensen. So we've had some changes regionally, but locally as well. And so it's really nice to be here and to see all of you and meet many of you for the first time. So I am here today to talk about home visiting and introduce the new model that we adopted in the last year, as well as represent regionally the home visiting offerings that we have and how home visiting can support breastfeeding, along with all kinds of infant feeding. So recognizing that it might look differently for all families, and we are able to support whatever infant feeding looks like for every unique family. So as you can see here on the slide, I have MESH listed, which is our new home visiting model. MESH stands for Maternal Early Childhood Sustained Home Visiting. It is a mouthful, so we just say MESH. It's much easier that way. You might have heard of our other models in the past: Nurse Family Partnership, Healthy Families of America. The really neat thing is that this model, while it originated in Australia many years ago, a couple decades ago, it made its way to the United States by way of Vermont. And now in Minnesota, there are more than 45 counties that have switched over to this evidence-based home visiting model. So there's something to it. MDH has also recognized and supports and holds the licensure for this program. So just a little bit behind what MESH is. Similar to the other models that we've worked with in the past, it is an evidence-based home visiting model. So there is some good science behind this intervention, particularly for the parent-child interaction and how it does support the health and development of children. But the really neat thing about this specific model is that it has a salutogenic framework, which means that it is health and strength based. Instead of looking at the disease and trying to fix the disease or the problems, we're really coming from the health focused approach. So finding what strengths exist and looking at what supports and interventions can support the entire family unit. So recognizing that it's not just about the babies, it always comes back to the babies, right? But really focusing on what what we need to, how we can support the parents and their well-being so that they can make the best informed decisions for themselves, for their aspirations, and for their families and their babies. So it has that really great ecological framework, recognizing that babies are part of a much more complex environment, knowing that it takes more than just one interaction or one part of their world to really be able to support their entire health. So as it relates to breastfeeding, which is what we are here today to primarily focus on, you know, the nurses, the model requires that trained nurses implement this model. Now I'm focusing on MESH because that is our evidence-based model. It's our long-term model, which means that we get to have a minimum of 25 visits over the course of 2 years. So we're really positioned to develop strong relationships and be in an intimate setting in our families' homes. Which, does it get more intimate than that? I don't think so. And so we're really primed to be in a position of knowing a lot of what's going on for our families and being able to help prenatally have those conversations about what infant feeding is going to look like, educating, offering information, troubleshooting. Maybe it's some mental health concerns, or maybe there are past experiences that might create uncertainties or barriers for the choice to breastfeed. And so we really get to dive into those conversations and work through that in the long haul. And then once baby is born, again, we are in that position to be in their home and hopefully at that point really have a trustworthy relationship in coordination with their healthcare provider to really support them through that breastfeeding journey. A number of our nurses are CLCs. In Carlton County specifically, we have all of our nurses are CLCs, which is just phenomenal. Many of those in St. Louis County are, if they are not CLCs, many have had breastfeeding education. Our Cook County nurse home visitor is a CLC, and our Lake County home visitor is also starting that journey as well. So regionally wide, we've got just really awesome support for our families in this way. So I'll stop there. The last thing I want to mention is, again, I'm focusing on this 2-year program, the MESH home visiting program. But please know that we also can support families universally. So each one of our counties, Lake, Cook, Carlton, and St. Louis, do offer universal home visits. So that's to anybody. It's a universal program for anybody who has a baby. We can offer those same supports, and we do. It's just I'm focusing on the long-term home visiting model because that is also just such a wonderful way to establish that long-term relationship and really develop that trust where some of those barriers might exist for breastfeeding. So I have listed here some of the contacts. Please reach out. We're in a really great place, point in time coming through the pandemic. Things were funky there for a little while with home visits. All of the counties did maintain home visiting through telehealth. And then once we were able to be back in person, we were able to get back into the homes. So as we're looking to really reestablish ourselves in the community and with our community partners, we really do hope that you'll consider referrals. It's a really simple thing to do. We can please reach out to any one of us. We are very friendly, and we can help navigate those referrals. And you don't have to worry about what model or what services or resources might be needed. We can help navigate that. So really, thank you so much for keeping us in mind. And I will stay on to take questions. Otherwise, I will turn it back to you, Megan.
Great, thanks, Michelle. Great information. One of those great wraparound services for patients and clients in our community. So again, jot questions down if you have them as we go through our panelists. We're going to go on to Jenny Barta next. Jenny has been a certified lactation specialist for 12 years and the WIC and peer program coordinators for Carleton County for 8 years, currently representing the Northeast Minnesota region in Minnesota WIC Advisory Group. And she holds the role of the WIC Peer Breastfeeding Program Lead for the 7 counties of Northeast Minnesota. So welcome, Jenny. And we can see your slides.
Great. Thank you very much, Megan. And good morning, everyone. It's so great to see some names and faces here. And it's also so great to see some sunshine in our corner, our neck of the woods. So as Megan mentioned, I am the WIC Peer Breastfeeding Coordinator for Carleton County, but also for the 7 counties of the Northeast region. I'm lead staff, and then I'm the WIC Coordinator for our local agency as well. So I will be presenting today some data on specifically on the peer program, but also on WIC. So this is breastfeeding statistics going back to 2019. This PowerPoint was developed by the Minnesota Department of Health's data analyst. Her name is Marcia McCoy, and it was presented at our peer program coordinator lead staff meeting in March. So it is used with permission. And I've also included some information about breastfeeding statistics amongst WIC participants in 2000 and the effects that the COVID-19 pandemic had on lactation. So this picture that you're viewing right here is a picture of our Minnesota Peer Breastfeeding Support Peers. This was taken at our last in-person state WIC conference, which I believe was in May of 2017. So this is a great representation of the peers that are working in the peer program across the state of Minnesota. So for Minnesota WIC agencies, not all WIC agencies have a peer support program, but for those that do, they're able to serve about 31% of eligible families and that enroll in that peer program. So the Minnesota WIC Peer Breastfeeding Support Program does hire and train women who are like those who are being served in the WIC program. They can provide some basic breastfeeding education and support for postpartum women, as well as that education during pregnancy. It is also shown that women with peer support have higher breastfeeding rates and longer durations than women without a peer. So here's some data and information about how many women are enrolled in the peer program in those agencies that have a peer program. This is Northeast specific data right here. So we do have a little bit less of our eligible population that has been enrolled, but we are working to try to increase that enrollment rate. As you can see, it has gone up a little bit from 2016 to 2019. So for the 7 counties in the Northeast region, that would be Aiken, Carleton, Cook, Itasca, Lake, St. Louis, and Coochin counties. Each of us does have at least one peer in the peer program, and some agencies have multiple peers. Here's some characteristics as far as numbers go for data eligible participants in the Northeast region versus statewide. Average contacts per client. Most of our peers average about 6 contacts per client. So they really are developing a relationship with these women to encourage them in their breastfeeding journeys and their lactation journeys with their infants. As you can see also the demographics, we have a number of American Indian, Black, African American, Hispanic, other Black and white women that are served in this program. Here's some trends in breastfeeding initiation in Minnesota WIC peer programs. For those women who are not assigned a peer, it is roughly about 76 to 78% will initiate breastfeeding. But for those women who are assigned a peer and who are enrolled in the peer breastfeeding support program, we have much higher breastfeeding initiation rates. As you can see, it averages in about the low 90th percentile. For some reason in 2018, there was a dip. I'm not quite sure why, but it did dip down to roughly about 88% in that year. Same goes for Northeast, but we do typically have slightly higher breastfeeding initiation rates. And I think that's due in part to the great partnerships that we have amongst not just our WIC programs, but our public health programs, as well as our healthcare agencies and clinics. We have a number of breastfeeding friendly hospitals or baby friendly hospitals up here, excuse me. And so of course that does help significantly with that breastfeeding initiation. So in the Minnesota WIC peer program, we have some data here. For those women who are enrolled in the peer program, it's about 93% of them will initiate breastfeeding versus women who are not enrolled in the peer program, it's around 78%. So this is statewide data right here. So as you can tell, those women who work with a peer do maintain those breastfeeding throughout that 12-month duration at higher rates than women who are not enrolled in the peer program. And the same holds true for the Northeast region. We do typically have slightly higher rates of initiation and duration, except for in the middle here compared to the state of Minnesota. So at 2 months and 3 months and 6 months, the Northeast region did have slightly lower rates than the state of Minnesota, but we did maintain a higher rate at 12 months for breastfeeding our infants, as long as you were enrolled in the peer program. So here it breaks out in race and ethnicity demographics right here. And as you can tell, women who are enrolled in the peer program do meet the Healthy People 2020 goals for all races and ethnicities except for Hmong. But as you can tell, with Hmong, those women who are enrolled in the peer program do have significantly higher rates of breastfeeding than those who are not. So it is definitely making a difference in that population to have that support of a peer. And the race and ethnicity demographics are a little different for the Northeast Minnesota region. However, as you can see, we do have some great initiation rates for those women who are enrolled in the peer program, but also those who are not. We do have some good initiation rates. Participants in the WIC Peer Breastfeeding Program do have significantly higher levels of breastfeeding initiation and duration. And here's an example of one of our peers who's breastfeeding her baby. Some more breakdown of demographics, Minnesota WIC peer agency participation right here. So this breaks it down into percentages of race and ethnicity for those women who do have a peer and those who do not have a peer. And this is statewide data right here. And then the next slide shows the Northeast region. So as we had seen in previous slides, the race and ethnicity data is a little bit different for the Northeast region, just based on our own demographics here. And we were not able to show the race and ethnicity data for Asian Pacific Islanders, as well as other Black non-Hispanic because of low numbers. All right, so right here, this one, apologize, I need to catch up with my slides here. So this is exclusive breastfeeding duration for the postpartum hospital stay. So peer program participants with and without peer support. So as you can tell, for exclusive breastfeeding rates, we do have higher rates in women who are receiving peer services than in women who are not receiving peer services. So this is Minnesota data right here. And the next slide is in the Northeast region. So it's significantly higher exclusivity rates in the Northeast region. Again, thank you to the baby-friendly hospitals. And we do also see a significant increase in women who are exclusively breastfeeding if they are enrolled in the peer support program. All right, and one last data set right here with the importance of exclusive breastfeeding during the hospital stay. And this is based on race and ethnicity data right here. So I won't go through all of it. I know my time is pretty limited. So this is Northeastern Minnesota data right here. So as you can see, higher rates again for those women who are working actively with a peer. So we're so grateful for our peers that are stepping alongside virtually, usually over the phone, telephone contacts or text messages, along with their participants to provide that support and that education and troubleshooting. Okay, now I'm going to move a little bit past the 2019 data and look into a bit of what the COVID-19 pandemic did in Minnesota for breastfeeding rates. So Minnesota WIC does track breastfeeding rates monthly for our participants to monitor the effects of COVID-19 crisis on breastfeeding. Medical professionals strongly support breastfeeding during the pandemic to provide optimal nutrition and protective immune factors found in human milk. Changes in hospital and clinic services in the response to the virus did create new challenges to initiating and sustaining breastfeeding. There was reduced labor and lactation support in the hospital because of early discharges and fewer resources post-discharge, which negatively impacted breastfeeding rates. Those who work in low-paying service sectors who are disproportionately women of color and immigrants have borne the brunt of economic impact of this pandemic. And the Minnesota Wic Program continues to provide breastfeeding support to parents across Minnesota and encourages families with infants to turn to Wic for help. Due to concerns about parent-to-child transmission of COVID-19, some infants and mothers have been unnecessarily separated immediately after birth. This interfered with the establishment of breastfeeding. In addition, there had been reduced commitment to lactation support in some birthing facilities, not all, but some were affected by this. Some families are being discharged early, and after discharge, many communities have fewer options to offer breastfeeding help. So these challenges, along with added social and economic stresses, may explain the decline in breastfeeding initiation and the increase in early weaning since early 2000, as you can see by data on these slides. The percentage of infants receiving formula during their hospital stay initially declined during the crisis, despite an increase in the number of fully formula-fed infants. But more recently, formula feeding has been increasing and is now more common than before COVID-19. Early on, many families were discharged early. Most supplementation occurs on the second day after birth when babies become more alert and seem to want to nurse nonstop. So this can cause concerns about milk supply that lead to unnecessary use of formula, especially when lactation support is not available, as you can see by some of our numbers here. From the first quarter of 2020 to the third quarter of 2021, initiation rates declined among all cultural groups, most steeply for Asian Pacific Islanders, which was 9.3 percentage points, for American Indians, for African American, and for white families. East African and Hmong WIC participants have had the smallest losses during this time period. The Hmong Breastfeeding Coalition hosts Facebook Live events in January 2020 and rolled out a series of culturally specific breastfeeding education videos, which may have helped to support their community. The Minnesota Indigenous Breastfeeding Coalition also offers online support to community members. During the hospital stay, many families don't receive support grounded in their history or culture. This can impact breastfeeding success. Once families leave the hospital, they don't have the usual support sources of support, such as visits from family or friends, breastfeeding support groups, or outpatient lactation care. Families may not be able to weigh their infant or to bring their baby to WIC, for instance, to be weighed, which increases anxiety about weight gain and milk supply. These factors can lead to early weaning. WIC encourages families to enroll their infants soon after hospital discharge, as WIC can help with breastfeeding. Many WIC agencies provide peer counseling services to pregnant breastfeeding women. As other resources have become available due to the pandemic, WIC continues to offer telephone counseling and support to the new families. And here's the resources page. And I believe that these slides will be available to all participants. That's all I have. Thank you very much.
Great, thanks, Jenny. So jot any questions for Jenny, and we'll come back to them at the end. Appreciate all of your information. We're gonna jump to Celeste now. She is taking the place of Naomi Defoe, who's on your agenda here today. So because of the quick transition, I don't have an intro for Celeste, but she is a public health nurse with Fond du Lac Human Services. So Celeste, if you want to unmute and give an update for Fond du Lac's doula services, that would be wonderful. And welcome today.
Thank you, Megan. Like Megan said, I'm Celeste Ekberg. I'm the Public Health Nursing Supervisor here at Fond du Lac. And I've been working here for about almost 20 years, let's just say. So Naomi had to be gone today, but I'm just stepping in for her to kind of review some of our doula program, talk about that. What we've done here at Fond du Lac is, I think over the past 11 or 12 years, established a doula program. What we are trying to do is hire American Indian community members who have experience in birth and parenting to become a doula. Our doulas also receive certification by the DONA program, Doulas of North America, and they also are WIC peer breastfeeding trained. So they kind of have a dual role there. Currently, we have 4 doulas on staff, and we'll plan to hire 1 to 2 more doulas in the next few months. We do try to incorporate cultural aspects around birth. So the doulas are able to make or teach clients how to make a belly button pouch. So that's, culturally relevant. We also have doulas who do placenta prints after birth. Families really like those. And then they, before birth, can do a belly cast. So we are thinking about hiring a dedicated doula program manager in the next few months. This is something that Naomi does as part of her role as public health nurse. And I think that a dedicated doula program manager will make things a little bit easier for the program. And then also we wanted to let you know that in the last couple of years, Fond du Lac reservation-wide has adopted a lactation support policy. And we provided staff support and training for that. And part of the policy is that the benefits department gives out information to employees when they request maternity leave or are pregnant or breastfeeding. So some employees are able to bring their infants to work. There's, different job categories that benefits, and but otherwise everybody is allowed to have time to express milk. We have created multiple designated lactation rooms, and along with a couple of our grants, we keep those supplied with, just things that a mom needs. Storage bags, pads, snacks. Sometimes we have beautiful art in those rooms just to try to make it more homey. And the purpose of the lactation support policy is just providing an atmosphere of support for breastfeeding people here on the reservation.
Wonderful. Thank you, Celeste.
Mm-hmm.
And again, any questions for Celeste, jot them down. We'll come back to them in a little bit. We've been able to use some of your lactation rooms firsthand, and they are beautiful. You've done a very nice job. All right, wonderful. Well, we're going to move to Laura Greensmith. Laura has been a public health nurse and a CLC for the past 12 years. She has previously worked in maternal child home visiting with Fond du Lac and St. Louis County, and is now currently working in the WIC program with St. Louis County. Laura has been the co-chair of the Northland Breastfeeding Coalition for the past 2.5 years. She's going to give us an update on the Northland Breastfeeding Coalition. Go ahead, Laura. Thanks for being here.
Yeah, thanks. Great to see everyone. So like Megan said, I have been the co-chair for the last 2.5 years for the Northland Breastfeeding Coalition. Many of you are familiar because many of you are members of the coalition, but for those of you that are not, our coalition is comprised of members from public health, both tribal and county public health in our area, as well as WIC staff, hospital staff, CLCs, and other lactation folks that are working independently, doulas. And what's kind of unique is our coalition does have a pretty broad geographic range, and it even includes some folks from Douglas County as well. So that's why we're Northeastern, because we're not just Minnesota. And it's really wonderful to have our partners, Douglas County and Superior. They're doing really great work there as well. So we have a pretty big reach in other counties as well, with Carlton and even St. Louis County folks up on the range, Lake County, Cook County. And so it's been a coalition that was established in January of 2003. So we're coming up on the 20th anniversary. And membership, of course, has fluctuated and changed over time, as have the events that the coalition has taken on, and just kind of a bit of the focus, I would say. I did want to touch on just kind of how things have changed more recently with COVID. So historically, we would meet every other month in person, and it was a great opportunity to see other people's spaces, be it the hospital lactation or WIC or public health. For example, going up to Lake County, many of us, hadn't seen their space before. But obviously with COVID, we have gone virtual, which has had pluses and minuses, as you all know. And so we have shifted to be virtual, which I think has allowed more people to attend in a broader range. However, a drawback, of course, is it is really nice to gather in person and see just the physical space for when we're referring clients as well, of just, where to go for certain areas. In addition, our activities have shifted. In the past, we've done a variety of things like the birth and baby fair and a lot of in-person tabling events, hosted events during World Breastfeeding Week in August, as well as some challenges locally, like challenges for nominations for breastfeeding friendly workplaces and childcare awards. And most recently, since I became co-chair, we applied for a mini grant with the Minnesota Breastfeeding Coalition to get books for local libraries, both for kiddos as well as like reference books for lactating people as well. During COVID, we've shifted to be a bit more of a professional collaboration and meeting place, and less able to do community-wide events in person. So kind of a place where we can all connect and get updates. It's an excellent place to get updates on what's happening in other areas in the hospitals, in WIC and public health, as well as just professionally connect with others that you may not know. So just networking has become a bit more of our focus, and it will be interesting to see where things lead in the future. On that note, I did want to just pass the floor over to my coworker, Hillary Boyce, who is now coming on as the current chair of the coalition. And Hillary will share just a little bit more about currently what we're up to and meetings as well.
Hey there, thanks Laura, and good morning everyone. I think I see some people that I've worked with in other places. It's so fun. Yep, my name's Hillary Boyce Schimpf. My pronouns are she, they. I'm a family home visitor at St. Louis County. So kind of working within those programs that Michelle had talked about. And then also just in January stepped in as the co-chair along with Laura for the Northland Breastfeeding Coalition. So just kind of wanted to extend an open invitation for folks in the community to join our meetings. We meet, I'm gonna say every other month virtually right now for about an hour and a half. And then I'm gonna drop in the chat and maybe try to pull up on my screen if I can figure out technology. Our website. So there's that link. And then let's see. Nope, I can't screen share, but I'm gonna let Megan's working on it, I feel like. I'll let you guys pull up that website, and then it has a few links for us. It has the link for this summit for today. And then just kind of notes also that we're a member of the Minnesota Breastfeeding Coalition. One of the things we've been working on recently has been the 90-day breastfeeding challenge, which was through the Minnesota Breastfeeding Coalition. Thank you, Megan. And so you can see there's a link there as well to the Minnesota Breastfeeding Coalition and MDH. So this is kind of our space on the interwebs, and then does have the Simply the Best newsletter links, as well as an event calendar that we're working on updating as always. So feel free to either email me, or I'm gonna say Laura or Megan. If you're interested in joining, Megan is the one who sends out the links, the evite links. And then if you have anything that you'd like to get added to the calendar or something, you just get in touch with us. So thank you.
Great, thanks Laura and Hillary. Thanks for sharing. Jot any questions for Laura or Hillary down. Thanks for being here. All right, we are going to move on. Let me pull up the, let's see, Kim's information. All right, we're going to move to Minnesota Breastfeeding Coalition updates with Kim. So Kim Welvert is the chair of the Minnesota Breastfeeding Coalition. A nurse and lactation specialist for over 29 years, she currently works as an RN IBCLC at CentraCare St. Cloud Hospital in the NICU. Volunteers her time as a co-chair for the Central Minnesota Breastfeeding Coalition, and is on the board for the United States Lactation Consultants Association. A former La Leche League leader and proud mother of 2 sons that she breastfed and provided her milk for over 4 years. And human lactation is her passion. So thank you for being here, Kim. We will pass it over to you.
Good morning, everyone. I apologize, I can't put my picture up at the moment because there's stuff going. I'm at work and I can't show myself. So the Minnesota Breastfeeding Coalition, we are having a leadership transition. Linda Kopecki, who you all probably know and love, she just received a position with the Minnesota Department of Health. So Linda will be stepping back from the Minnesota Breastfeeding Coalition, and we are actively looking for a new interim ED. And we're hoping to have that person in place by June. If you know of anyone that would be a good fit, if you would be a good fit, please contact me. The information is on our website, and we're going to be posting different things on our social media accounts as well. Right now, the position about 10 hours a week, and then with the ability to do more hours. But we're a great group, so please come join us. The website has been updated. You probably, if you've been on there recently, we're always putting in updated information as we get that. The 90-day challenge, as someone mentioned earlier, we're wrapping that up, and we have a big celebration here on the 11th. Very exciting with seeing what great ideas all the different coalitions are doing. So thank you for your work and time and talents on that. And then we are continuing to offer virtual workshops. I'm not sure if we'll ever get to the point again where we do in person, but the virtual has been a very highly successful. If there are topics you feel that would be important for Minnesota, please let us know. We want to provide information, education that is useful for you in your daily personal and professional lives. And then we are also looking for board members. We are looking for a chair-elect, treasurer-elect, and at-large members. And information will be coming soon this summer about that.
Great, thanks, Kim. And people can sign up on the website for your email listserv, correct? Sorry if I missed.
Yes, correct.
Okay, perfect. That's where you can get a lot of the details about what's coming up and happening with Minnesota Breastfeeding Coalition beyond just their website. So thanks, Kim, for being here and updating us. All right, jot any questions down for Kim, and then we will move into our last but not least panelist, Holly. So Holly Glabbitz earned her BS in Physical Health Management from Dakota State University and a master's degree in Public Administration from Drake University. Holly has worked in the workplace health and wellness industry for over 25 years. And she currently works as a workplace wellness coordinator at the Minnesota Department of Health, providing technical assistance for local public health partners working on the statewide health improvement partnership. Holly is a native Lowen and diehard Hawkeye fan who lives in Wisconsin. While she lives in Badger Country with her husband and 3 sons, she thoroughly enjoys working for the Minnesota Department of Health and with local public health partners to improve the health of all Minnesotans. So thanks for being with us today, Holly. We'll turn it over to you.
Yeah, thanks, Megan, and thanks, everybody. I'm happy to be here today. I'm going to update you on a couple of things. So at the Minnesota Department of Health, you know that we definitely support breastfeeding in a variety of spaces and places. My work is primarily with workplaces, but I do help facilitate the other breastfeeding friendly designations other than the maternity center. So I just want to talk just briefly a little bit about why we want to support breastfeeding in the workplace and kind of the elevator pitch that we give to employers when we're starting to talk about why it's important to create those lactation spaces for breastfeeding employees. We do know that there is a return on investment actually for providing lactation spaces and supporting breastfeeding employees. You can see some of the statistics here. We know healthy baby means the employee is going to be at work. And we also know that absenteeism is lower among parents who breastfeed their kiddos. We know that, again, you can see where breastfeeding reduces healthcare costs, which employers find important. And I know Megan has the slide deck and she will share this along with the deck along with some other information to you as well. But we also know that among employers who have lactation support programs in place, that they have an 86 to 92% retention rate, anywhere from 86 to 92% retention rate, which means that once the employee returns to work after parental leave, they're going to be more likely to stay at work if they know that they're supported. The other reason is we know that it's also a state law. So Minnesota has a state law that supports breastfeeding employees, and there has been an update to this law. So first, just some of the basics. We know that there's a federal law, but also, as I mentioned, a Minnesota state law where employers need to provide time and space for breastfeeding employees to either express human milk or breastfeed on site. We know that they need to provide the time, but also they need to provide a space that's free from intrusion And we like to recommend no further than 5 minutes from walking distance from the employee's workstation. Now, effective just this year in 2020, January 1, 2022, there has been some strengthening, I guess you could say, of the break time component of the state law. And I'm going to link, when I'm done speaking, I'll put in the chat some information from the Department of Labor and Industry that does a great job of summarizing the new components or the new break time piece to this law. And it basically says that employers can no longer reduce the compensation of employees who are going to express human milk at work. So what that means, so it doesn't mean that the employer needs to start paying the employee for the already allotted break time that they have. They should continue. So for example, if an employee has like 2 15-minute paid breaks and a half-hour unpaid break throughout the day, that stays the same. So it should be the allotted break time that they're already given should basically stay the same. The employer doesn't need to now go back and pay them for the 15-minute break time. What it does mean is if an employee needs extra time, for example, they need another 15-minute breaks, they can no longer ask that employee to use paid PTO or vacation time or sick time or whatever they have to offset that time. And they can no longer request that the employee comes in early or stays late to offset that time. So they can't, that's considered a reduction in compensation and they can no longer do that. So again, like I said, I will link some of that information from the Department of Labor and Industry in the chat when I'm done. And I know I gave Megan a really great handout that some of our fellowship colleagues put together that explains not just the difference in break time, but also there's been some changes in the pregnancy accommodations as well. And then that information the pieces have that information in them as well. So we know that at the Minnesota Department of Health, and I mean, we know as a group here that return to work is one of the primary reasons why nursing parents or breastfeeding parents stop breastfeeding, right? In some instances, it's one of the main reasons. Because of that, at the Minnesota Department of Health, we put together a breastfeeding friendly workplace designation. The idea behind the designation is to increase the number of workplaces supporting breastfeeding families and to recognize the importance of employer support. And we want to support parents to continue breastfeeding for up to 1 year and beyond. So our designation, and again, I'll drop a link into our website where you can get more information, not just on the workplace designation, but the other designations that are out there. Our designation uses a step process. So support, time, education, and place. When we're talking about support, we're talking about a policy, a guideline, or even something in the employee handbook that says they are an organization that will support their breastfeeding employees. In addition to just having the policy or the guideline, we want to see how they're going to communicate the policy or guideline to their employees, and not just the employees that need to use the lactation supports, but employees overall. How are they going to let managers and supervisors know that this is something that they do as an organization? How are they going to let other employees know that they support their breastfeeding employees? So they need to be able to show that. Time, again, that's in both the state and federal law. They are, and I just went over some of the changes there, but one of the questions I will say that we get a lot from employers is how long should this take? I mean, how long should they be away from their desk? And our answer is usually as long as it takes. It's a very individual thing. It can take some parents 5 minutes. It can take some 10 or 15 or longer. So the E is education. So we want to show how are they going to promote resources within the community that are there to help their breastfeeding employees. And that can be through information on a bulletin board in the lactation room. It can be information around the benefits of breastfeeding and community resources that they give at when someone requests leave. There can be a variety of ways. It can be a peer support, a breastfeeding peer support program within the workplace. Sometimes those will happen very organically. Or they can have a parental support program as well. So in education and then place. And again, the place should be free from intrusion, preferably no more than a 5-minute walk from somebody's workstation. We've had employees ask, you know, we're limited on space. We don't have the ability to put a lock on the door. So we'll recommend that you can buy portable locks off of Amazon, and they're pretty inexpensive. We've seen a variety of things. When it comes to different places, we've seen closets cleaned out and turned into a lactation space. They end up actually looking really nice. So we just need to make sure that that place is free from intrusion and fairly close to the employee's workstation. We also ask that they evaluate what they're doing. And of course, we want to know, the employer should know if what they're doing is working. So one thing is to evaluate and update the policy regularly. And given the new language around break time, we're really pushing that with our employers now to make sure that they have that updated language and that they have a minimum of 1 year also included into their policies. Making sure that they are serving staff who have used the lactation room or the lactation support program, and making sure that the process is fluid. So there may be changing needs within the organization. If there's a baby boom, for example, they may need to come up with initial space. So continually thinking on process improvement as well. If you'd like more information about the application, it's on our website. Like I said, I'll drop some of the links to the DLI information as well as our website into the chat when I'm done here. And with that, I want to thank you all, and I will turn it back over to Megan.
Great, thanks, Holly. Great information. And the handout that Holly mentioned will be coming out with the slides and materials from today's meeting. So you'll get that. It is a really great, straightforward resource that you can use to help educate leadership and others. So wonderful. Well, we're to the end of our panelists, and we have some time for questions before we open it up into a little bit more open updates. So we're going to answer questions that you have specifically for the panelists at this point before we move into some open updates. So if you would like to either unmute or throw a question in the chat. I've been trying to monitor the chat. I haven't seen any questions come through, but feel free to unmute or ask via chat, and we'll answer those now.
Hi, this is Allison. I have a question for the Minnesota Breastfeeding Coalition. We currently use the prenatal toolkit that you developed. We laminate it and make a flip chart of it and use that as our teaching tool for when moms, well, we're starting to give tours again at the hospital when people, you know, our visitor restrictions have been lifted. So I was just looking at that. Do you know if there's any talk about updating it? I see the latest update was like copyright 2016, distributed in 2017. So I was just wondering if there's any news on that. It still looks good to me.
Yes, we are looking at all of the toolkits and trying to update them as we can.
Okay, thanks.
Great question. Thanks, Allison. Any other questions? All right, we have one that came through in the chat. Are breastfeeding employees required to use their existing break times for milk expression before using additional paid breaks? That is, instead of using the bathroom or having a snack and other uses for standard breaks. Holly, do you have input on that?
Yeah, the answer to that is yes. They should be using their already allotted break time first, yes. And all that information is in the link to the DLI page as well.
This is Allison again. So just another question about the break time for employees. So the new law, am I understanding correctly, is just clarifying that if an employee needs more than the standard break time to express milk, they can take that time and they do not have to use their PTO or vacation time to cover that. So they could potentially be paid for a 7-hour workday or 7.5 instead of 8 hours. Is that how it reads?
So no, it reads basically that you are correct that they can't, if they need another 15-minute break or whatever it is that they need to, they can't use, that time would need to be paid if they've used all of their allotted break time already. So they would have to use whatever break time they already have. Then if they need additional break time, then that would, their compensation can't be reduced. So that would be paid.
Or you're glitching, so it would be paid.
Yeah. You just
Okay.
can't, yes, they just can't, you can't require them to decrease compensation at any time.
Okay.
Okay. I should say outside of their allotted break time. Again, you don't have to go back and start paying them for unpaid break time now. If it's already their allotted time, it would be any additional time that they would need.
Okay. Okay. So say instead of a 15-minute break, they need a 20-minute break. They're still earning the same pay for that, let's say 8-hour day.
Right.
But just for pumping purposes, taking 20-minute breaks versus 15.
Yeah, and if you read the information from the DLI, it kind of talks about how it's combined break time overall too. So yeah.
Okay.
They do a really good job of explaining it, much better than what I'm doing right now. And I should say, if you have any questions about this, I'll drop my email in the chat and email me, and I will get you connected with them as well if I can't answer it. So.
Okay. All right. Sounds good. Thanks.
Yeah, great questions around the break times. I know that's been a major question that's come up with a lot of organizations at this new statute. So. Great. What other questions do you have for our panelists?
So I guess just going off of that too, I saw it was for the first 12 months. So if somebody wants to, participate in extended breastfeeding, are they still able to be paid, without a reduction, or is it just for the first 12 months?
It would be just for the first 12 months. Anything after that, they would negotiate with their employer.
Yeah, that's a great question too. So local policies can always be stronger than the state too. So if you decide, within your organization that you want to make it 18 months or 2 years or, whatever, you have the flexibility to do that too. Or like Holly said, negotiate too. Wonderful.
I have a quick question. Was there any change in the state law for the size of the employer, like how many employees they have, or did that stay the same?
It's any employer that has one employee. So the Minnesota law is stronger than the federal law. The federal law says 50 or more. The Minnesota state law actually says 1. If you have one employee, unless it creates an undue hardship for the employer, they should be providing space and time.
Nice.
Great. And I know most of the presenters have put their emails in the chat. We can provide those when we send the materials out as well, if you have specific direct questions. But I'll ask one more time, any other questions that anyone has? These have been great. Good discussion. Right. Wonderful. Well, thank you so much to all of our panelists for sharing today, to take time out of your day to share what you've been working on and some regional efforts and statewide statutes and all that good stuff. So we are going to move into some open updates right now. And what that means is just, we know that there's a lot more happening with breastfeeding support across the region that we maybe didn't highlight in the panel, but wanted to give time if you are part of a healthcare organization or a local entity that's doing breastfeeding support work. If you wanted to give just a brief update, we know COVID has been changing policies and protocols and changing our work here and there. Some are getting a little bit back to normal, some are still functioning virtually. So there's just a lot of change happening now, and we know that, and we want to give you time if you wanted to provide any updates on what your organization is working on for breastfeeding support for families. So I will open it up. If anyone wants to take themselves off mute, feel free. Or if you have a really brief update that you want to throw in the chat, you can do that too.
Well, this is Kim Welvert again. For those of you that have done a big latch-on event, I am on the Facebook host group, and the big latch-on actually came out saying they're not going to have one in August like they normally do. Because this organization is based in New Zealand, and they're planning to do a big latch-on in April of 2023. And they have asked that if anyone decides to continue doing an event this August, that to not use the terms big latch on or global big latch on.
Great update. Thanks, Kim.
Hi, this is Allison. I can give you an update from Moose Lake. So I shockingly discovered when I went on the Baby Friendly USA website last week that there were a lot of things that were due on Monday, a couple days ago. So last week was a busy, crazy week for us, and lesson learned, don't do that again. But we are in our 4th year of the Baby Friendly USA designation. So apparently that's a big year where we have to do all audits on all 10 steps. And then next year we will have our site visit. So things are more complicated being a part of the essential health system, because policies are integrated or not integrated, and things like that. So it's been a lot more work, I would feel like, than it even was from the beginning, except I'm glad I'm familiar with the whole Baby Friendly website and all of that. So we'll be busy doing all of the audits that need to be done, and those are due July 1st. So it'll be interesting, good information. And it's kind of prompted us to make sure we're getting our staff education done and working on a new system for that. So we have 3 or 4 new nurses coming on into the OB department. So we'll be doing lactation training for them. So that's exciting news. We have a new CLC on board. Jackie Grandforce just became certified. So she's helping me with outpatient lactation, and then she works full time in OB. So she is there with the moms and babies. So that is very nice for me. We are working with Carlton County and Pine County. They scheduled some block times twice a week that we can just fill in those block times and let the patients know before they even leave the hospital that a county nurse will be coming to see them on such and such a date. And so far, it's working out pretty well, I think. I think sometimes the patients avoid those visits once they get home, but at least some of them are working. I guess the county nurses will be able to let us know a little bit better just how successful we've been. But from my standpoint, trying to arrange for longer term lactation support outside of the hospital, it's been really helpful to have those block times. So I do appreciate that. It saves me a lot of legwork trying to coordinate care for these moms and babies. So I'm just working on trying to make sure our OB nurses know the process. So if I'm not, they're still following through with that process. So other exciting things. I don't know. I think that's about it for our updates here in Moose Lake. Is the baby friendly business is occupying most of our time.
Wonderful. Thanks for those updates, Allison. That's great. And a great model for others for using that block time to have the public health nurses there. That's a great systems level change that will help support that kind of wraparound care for patients. So
yes.
Yeah, so the contacts on Michelle's slide that you'll get with the MESH program, and then probably Celeste, if I can suggest your email, if people wanted to reach out to contacts for local or tribal public health to set up something similar, feel free to reach out. So that's great. I did see an update from Mallory in the chat. Pine County continues to support the Babies at Work program, where employees are welcome to bring their babies to work or work from home until they reach 9 months of age or the baby starts to crawl, whichever comes first. All of our family home visiting nurses are now CLCs as well as health educators. So great, that's a great update. Exciting. Wonderful. Any other updates anyone has from your organization? We have a few minutes left for a few more if anyone has any.
This is Jen Nyland from St. Luke's.
Perfect. Thanks, Jen.
Hi, so I'm just updating you. We're kind of in this baby friendly also. So last fall we did all of our audits and Lori's done the pre-interview questions. And so now we're really focusing on getting our staff up to par again. We've had some turnover, so getting them all educated and getting ready for our site visit, which I think now is slated for November for our second site visit. As in regards to just lactation support, that really hadn't changed when COVID hit. We continue to keep our aftercare office open. We continue to follow our moms until they're able to exclusively breastfeed. I think our biggest challenge has been we've had a big increase in moms that have had pre-E. and earlier inductions, like around that 37-week mark. And so a lot of those late preterm babes, we've been having to follow a little bit more closely and just helping those moms get a good milk supply established. And yeah, we haven't started up our support group yet. I'm not sure when that'll happen. We used to meet the first and third Wednesdays of the month pre-COVID, but right now that still remains on hold.
Great updates. Thanks, Jen. Thanks to so many of our healthcare facilities across the Northeast region are baby friendly, and it's just so great how committed all of you are to that work. It's a lot of work, especially like you said in that year 4 and moving into the 5th year. So great work. I did want to ask too, after I thought about it for a minute, Mallory, if you're willing to stick your email in, if anyone's interested in seeing like whether it's a policy or a protocol that you've developed for Pine County that supports that, bringing babies to work or working from home until 9 months. If you're willing to add your email address, if people want more information or can reach out for samples of information, that would be great.
Sure, definitely. I can share that. I wasn't a part of creating it, but definitely a part of participating in it. But I'll talk with supervisor and administrator and share some of our policies and stuff that they created.
Okay, perfect. Thank you. Much appreciated.
Yeah. Thank you, guys.
Anyone else with updates?
Well, I think just to add on with what Jen was saying, I'm from St. Luke's as well. I work in the clinic, care coordinator, social worker. I'm really excited because we're having our new clinic in 2023. So that will have nursing pods, which I think is really great for moms, probably in the waiting area, just so they can have that option available to them. So further support for breastfeeding.
Wonderful. It's exciting news. Thanks for sharing. And I didn't mention at the beginning, I apologize. Our first section will be recorded today, and then Carrie's section will also be recorded. So if you have coworkers who couldn't make the training today, the summit, they will be able to view this. So we'll send that information out as well, where the videos will be housed and how they can access that. Unfortunately, for capacity's sake, we won't be able to track all of the evaluations and post-tests and that kind of thing. So if somebody watches it afterwards, we won't be able to provide the CERPs and CEUs, but happy to provide the information in general for people to learn. So. All right, who else has updates?
Hey, can you hear me?
Yeah, go ahead, Ashley.
Hi. So I just kind of have some exciting news on my end. I just recently signed with Lactation Network. They are a biller, so I can take most insurance through Blue Cross Blue Shield, Anthem, and Cigna PPO. So it's not everything, but it's a start. So I'm kind of excited about that.
Wonderful. And if you want to throw your information, your contact information into the chat, did you already?
No, I didn't. I'll throw it in now.
Okay, perfect. So people know how to get a hold of you. Wonderful. I hope your little baby feels better too.
Thanks.
All right. Well, good deal. We're coming up. We have about 3 minutes before the next agenda item starts. So I'll ask one more time if there's any other updates. Otherwise, you can always throw something in the chat. All right. Well, we're going to move to our square table breakout rooms. I'm going to just pull up this slide for directions for you guys here. All right. So the reason they're called square table breakout rooms is because we're not able to be together around round tables, which is usually what you have in person. And since Zoom makes everything into a square, we will be in square tables today. So we're going to have about 25 minutes for discussion in your breakout rooms. We're not going to record this, as you saw, the recording has been paused. A home visiting program. During her time at Dakota County, she became an international board certified lactation consultant. She transitioned to the hospital setting where she worked for 6 years as a lactation consultant, providing both inpatient and outpatient lactation support services, and also filled the role of the maternal outreach coordinator. She supported her hospital system in the process of achieving baby-friendly designation in 2014. Carrie now works at the Minnesota Department of Health Wic Program as the peer breastfeeding coordinator. She lives in South Minneapolis with her husband and 2 sons. She enjoys spending time in nature with her family and has been a member of the same book club for 17 years. Impressive. So thanks, Carrie, for being with us today and sharing your words of wisdom. And you can go ahead and take it away. We can see your slides.
Great. Well, thank you guys so much for including me in your summit. It was really wonderful to hear all of the great work that's happening in the Northland during the panel updates this morning, and then to hear some of the creative ways that organizations are supporting families, kind of as we're all recovering from the pandemic, to really reconnect with families and find ways to really have that community collaboration and connection. So I appreciate being able to spend time with you all this morning, and we're going to chat about supporting families overcoming barriers to lactation success. So we have folks joining us, from a whole lot of different sectors, because lactation does intersect with so many aspects of our life. When we talk about, the hospital setting, we talk about work sites, childcare, all across our world is where families are interacting with lactation. And so we really need services that span the entire system. So I've been fortunate to have the opportunity to work across the continuum of lactation, and also experience lactation as a parent receiving those services. So I'm going to share a little bit about my perspective of having, worked in a few different sectors, and then also just as my personal experience. So you can see here my 2 little kiddos who are not so little anymore. So my son Odin was born in 2008. And at that time, there were no baby-friendly hospitals in Minnesota. And then when I delivered Griffin 4 years later, there were 2 hospitals in Minnesota that had received designation as baby-friendly, and there were many others that were in the development or dissemination stage of the process. And so we really could, I saw the really dramatic difference in lactation support that I received in the hospital, and the education, and just the way, all of the breastfeeding friendly aspects were integrated into the care received in the birth center. So that was really a great opportunity for me to see the difference that implementing those evidence-based breastfeeding care can have on a person, experiencing that firsthand. So I was able to nurse Odin for 12 months, and then I was able to nurse Griffin for 3.5 years. So I definitely felt like the support, and obviously my just own experience and knowledge with lactation helped improve my own personal outcomes. So my first role working in supporting families was as a family home visiting nurse. And as I believe it was Michelle shared this morning, that you really do have the privilege to have that intimate long-term relationship with families when you're visiting them in the home. And I often was supporting families that were struggling with, breastfeeding issues. And I didn't feel like I had the tools to help them as much as I wanted to. And a lot of families, have a lot of barriers to receiving lactation support in the community. transportation issues. It's challenging to sometimes access lactation care. And just, fatigue and exhaustion and trying to leave the house with a little one is challenging. So I really wanted to be able to bring that support into the home with me when I was visiting with families. So I was lucky to be able to attend classes and become a IBCLC during that time. And that really, was a change that inspired me to then go on and become a hospital lactation consultant. So in 2013, I started working at St. Joe's Hospital in St. Paul. Unfortunately, they don't have a birth center anymore, but it was at that time part of the healthy system. And I started, and a year later is when we were designated as a baby-friendly hospital. So I was able to take part in the process of educating staff, updating our policies, really integrating the 10 steps into our birth center care and updating our ability to monitor our breastfeeding efforts. So that was a really, challenging accomplishment, as folks have shared in the updates. For the systems that are currently looking at their redesignation coming up this year or next, that it's a daunting process, but it is a process that's worth it, because we do see, amazing outcomes with families who have that care during their hospital stay. So I currently work with the Minnesota Department of Health Wic program as the peer breastfeeding coordinator. I joined this program about 2.5 years ago. And I was really inspired to be a part of the peer program because I saw firsthand the families that were connected with peer breastfeeding support were better prepared for their hospital experience and really felt like they had that trusted person to turn to when they had concerns. And so they felt empowered to really overcome their struggles. They were prepared to know that there might be struggles, but they had someone who had their back, who they could call on, who was there to support them. And so I really wanted to be a part of that program because I just feel like it's an amazing model of support. And I know that we have a few of our amazing peer counselors from the Northeast region on the call today. So I'm excited to have you guys here and to represent the amazing program that is happening in the Northeast. Also, on a personal note, I am from Superior, Wisconsin. My parents live in Superior, Wisconsin, so I have that connection to the Northland. So it would be fun to be able to be up there and see you. And I love visiting the Northland. And the Northland has also, just been a leader in lactation services in our state. The number of hospitals that have implemented baby-friendly or other versions of the 10 steps outnumbers those across the state. Your breastfeeding rates are, the leader in the state. And so the work that you guys have done is really making a big difference. So it's exciting to get to connect with everyone up there who is a part of that great work. So today we'll look at the racial, cultural, socioeconomic disparities that we see in lactation rates in Minnesota, thinking about common barriers to lactation success. We'll discuss counseling strategies to help build that self-advocacy to empower families to meet their feeding goals. And then we'll examine opportunities for collaboration across the continuum of lactation supporters. So how are we doing with lactation in Minnesota? So Jenny shared some information from the state this morning with a little bit of information across the state, and then some further information about the Northeast region and the peer program. And I'm also going to share a little bit of information. So like Jenny, this information was put together from Marcia McCoy, who's our WIC epidemiologist. We're really fortunate to have 2 epidemiologists in the WIC program who can help us really take a deep dive into what's going on in lactation in our state so that we can work on strategies to help decrease disparities. So the slide that you're seeing is showing breastfeeding initiation among all infants born in Minnesota. So this is birth certificate data that is recently been updated. So it's the finalized version of births from 2021. And we're looking at the initiation rates over the last 5 years. So the graph on the left are families that are not on the WIC program. And then the graph on the right are families that are receiving WIC services and participating in the WIC program. We can see when we first just glance at this graph that we have large socioeconomic disparities in our state, that there's a big difference in outcomes based on our socioeconomic status. And then when we look deeper into the colors that are represented here for the racial, cultural, and ethnic groups in Minnesota, we can see that we have large disparities based on those racial and ethnic groups. And unfortunately, all of our rates have been declining over the last 5 years. And those gaps that we already had in our racial and ethnic disparities have widened due to factors from the pandemic. So we do have a time in Minnesota where after decades of rising initiation rates, that we are in a state of decline, and we really need to regroup our efforts and think about how we can best support families and how we can support families to help reduce our racial and ethnic disparities that we have had persistent in Minnesota, but that are widening with the impact of the pandemic. So I'm going to ask for everyone's participation, and we'll try out something that I just learned at a conference that I attended, and so we'll see how it goes today to have everyone participate. But I would love for your input on what you have seen as the biggest factors in your community that have led to that decrease in initiation rates due to the pandemic. So on the next slide, I have some factors on bullet points, but I would love to hear what factors you see that aren't already listed on the slide. And then also which factors that I've already listed you feel are most concerning in your community or had the biggest impact. So if you go up to the top of your slide or of your screen, you'll see something called View Options, and then you can click on the Annotate option. That after you click on that, it'll open up this second toolbar that we see. And if you click on text, you can add your own response. Or if you click on stamp, you can choose to highlight a response that's already there that either I've added to the slides or somebody else has added. So I'm going to go to the next slide and ask you guys to annotate and share your own personal information. So if you click on that annotate and then you click on text or stamp, you can add information. So I'll show that I've clicked on the stamp and I have a star, and that I can see that lack of lactation support, and I can see others joining. So people are figuring it out. Thanks so much for playing along in the So we see definitely a lot of responses for lack of prenatal care and education, disproportionate impact on families with low socioeconomic status, lack of lactation support, early discharge, lack of confidence. Thanks for adding in your own lack of in-person services. Yeah, I definitely, that definitely came up a lot in our breakout room this morning of just, it's more challenging to not have the option for in-person lactation services. We can do a lot over phone and text, but sometimes lactation just really does need that in-person connection. And it just helps us really, build connections with the families that we're working with. Fear of accessing in-person services due to COVID, definitely. Lack of awareness of lactation support. Yeah, I definitely agree with that. And hopefully, summits like this can bring awareness to all of us, so that we are really supporting families across that continuum, and we know who we can refer to and who are our colleagues in this support network that we're sharing with families. Social media preferred by participants. Yeah, so maybe we do need to look at other ways that we as lactation supporters can provide some of that social media contact for families that are looking for that, but making sure that it's evidence-based and it's support that can be connected with additional support if needed. Well, thank you guys so much for all of this great input. So I'll save this slide and then we can send that out. I'll send it to Megan and it can be included in the slides that go out, because I think you guys have all shared a lot of really important aspects of the effects of the pandemic. Healthcare is not culturally competent or relevant, and that is a huge one in Minnesota that we have some efforts to try to help improve with helping support BIPOC lactation supporters becoming lactation consultants and connecting families with peer counselors. But it's something that we have a lot of work to do in diversifying our lactation support field. Well, thank you guys so much for all this wonderful input and collaboration in really helping us look at the picture of what's happening in our communities right now. How can we all work together to move forward? And we have a lot of things that we need to overcome after this challenging couple years with the pandemic. So if you'll click on the little red X that's on the kind of annotate toolbar, that will close out so that you don't have to see little hearts and stars and check marks on the rest of the slides that I'm sharing. So you can kind of click that out, and then we'll be able to move on to our the next part of our presentation. So we've looked at breastfeeding initiation, and we saw that we've had a large impact with the pandemic on our rates. And the breastfeeding duration rates that we have available, the most current statewide rates are from 2018. And so these obviously don't reflect the impact of the COVID pandemic. So, it is not going to be surprising when we see lower duration rates, because we are seeing lower initiation rates during the pandemic. And so we know that if we don't start breastfeeding, we're not going to continue, and that duration is a very challenging piece of our breastfeeding journey. And so it will be definitely disheartening as we see those duration rates that were from the pandemic. But even looking back from 2018, before the pandemic, we can see that the blue bar is representing all of Minnesotans from the National Immunization Survey data. And then the green bar is representing the families that are participating in WIC services in 2018. So we can see, again, those socioeconomic disparities in lactation initiation, and then a large impact in our duration for 6 months. So 66% are breastfeeding at 6 months as all Minnesotans, and with our WIC families, it's closer to 37%. And then at 12 months, 40%, and down to 20%. So we have a large impact as well on duration rates for supporting families. Knowing the important health benefits for parent and baby, for the importance of breast chest feeding, isn't enough to support families or to help families initiate and maintain lactation, because there's a lot of other barriers happening in families' lives that are really driving these inequities, these large systemic structural barriers. So when I was a family home visiting nurse student, I did my practicum with the Minnesota Visiting Nurses Agency, and we received a lot of referrals from hospital discharge to follow up with families in their home. And we happened to get 2 referrals back to back that we scheduled that day for families that had just been discharged from the hospital the prior day. So they each had 3-day-old newborns that we were visiting in the home. The first family that we went to visit, we had an interpreter with. English was a second language for the family. They were recent immigrants to Minnesota. They didn't have family support or a lot of social support. They were renting a room in a home that was in really poor condition. There were these brave cockroaches running around during our visit, coming out in daylight. And so we were there to help, follow up on discharge and help support lactation and check in on mom and baby. And we spent, the majority of our visit really helping the family with financial paperwork, with financial concerns. We had the, ability to have interpreter services to help the family read paperwork and bills. And the biggest concern happening in their lives that was taking precedent that day was really the other concerns in their life. And they didn't have as much time to stop and really take care of mom's needs as she's recovering postpartum, thinking about how we can support lactation, the importance of all of of helping the family address the other concerns in their life really took precedent that day. The next family that we went to visit lived in a condominium in a high-rise in downtown Minneapolis overlooking the river. It's the fanciest apartment I've ever been in. We were greeted at the door by 2 sets of grandparents who had come to stay with the family, excited to meet their grandchild. We spent, the entire visit really helping the family process their labor and delivery, talking about postpartum healing, supporting latch, doing a thorough mom-baby assessment. And so we can just see that the context that families are navigating their lactation concerns can be so different depending on what social and economic barriers they're facing. Do they have lack of access to healthcare? Are they impacted by systemic racism and implicit bias? Is there financial instability? Is there lack of community and social support? Do they have a lack of education? Do they have housing instability? There are all these aspects that really impact, helping families meet their lactation needs, depending on all of the other factors in their world. And so having that experience of that back-to-back contrast in the context that families are experiencing these really helped me be able to pause and center families in the work that we're doing and considering all of the implications of what's happening in their life and really helping families explore different ways to get support to address the other barriers in their life. So we could see with all of the barriers that families face, it's not surprising that 60% of mothers who stopped breastfeeding did so earlier than desired. Women themselves want to breastfeed for reasons other than health. They talk about the feelings of loss they experience, while women who have been able to meet their goals talk about the feelings of connectedness and pride they feel. Many women who wanted to breastfeed but were unable to feel a host of negative emotions precisely because they wanted to, not because they were told to, but because their experience was important to them. Therefore, to make any real difference, we need to create a better environment for women to breastfeed in. Well, we can, we've really thought about how the pandemic has impacted the families that we are here to support. And we are not alone, or they are not alone in that impact of the pandemic. It has also had a really large impact on us as lactation supporters. So we know in the hospital setting, you were stretched way beyond capacity, dealing with families that were concerned about the fear of COVID. Would they have family support in the hospital? Could they have visitors? Could their partner be there? So many unknowns related to the COVID fears. you might have had personal loss of loved ones, supporting other families through loss, being reassigned if you were in the public health sector, being reassigned to support the COVID response. So all of these have really contributed to burnout. It's also been more challenging to collaborate across sectors. So we, are picturing these little silos here, and we have been even more siloed than we typically have been, without the ability to have in-person meetings, without the ability to have these events in person where we can make that personal connection and get to know the lactation supporters across the continuum of care, without the community events where we're outreaching to families and other organizations. Really that lack of time and energy due to all of the demands of the COVID response. So it has been, a challenge for families, and it has been a challenge for us as lactation supporters. So this is really a time where we want to think about how can we reestablish those linkages so we can strengthen our collective capacity to address structural barriers and continuity of care breakdowns that contribute to lactation inequities. So I'd love if we could launch the poll so we can think about what sector you guys are providing your lactation support and how we can connect across those sectors. All right, so let me know if you can't see the poll, but I've launched the poll, and I would just love for everyone to share in what sector they provide their lactation support. And then if your sector isn't included there, if you could add it in the chat. We're about 70% completed, so I'll wait for just a couple more seconds, and then we'll launch our poll. So the majority joining us today are from the Wic program, 40%, and then we have family home visiting at about 30%, the clinic setting 14%, hospital 6%, other public health 8%, community groups 3%, and then thanks for adding your other in the chat, private practice, virtual and in-home visits. And it's great to hear that you have access to being able to bill insurance for your lactation services. So that's an exciting, thanks for sharing that earlier this morning. So we have a lot of, collective support that we can share with families across the continuum of care. And we want to think about, how can we bridge the gap and really help families feel supported each step of the way in their lactation journey. So let's think about what leads to supplementation and early weaning, and how can we, in all of our different avenues of interacting with families, help support them in meeting their goals. So the continuity of care blueprint that was developed by NACCHO and USBC identified insufficient milk supply, latching challenges, lack of support, and return to work or school as common barriers to suboptimal breastfeeding. These concerns can be addressed by preventative, coordinated, community-based skilled lactation support. So we can overcome these challenges by working together and really creating that support for families. So we're going to watch a little video clip of families sharing their concerns to get the family perspective. Oop, except I think I didn't probably share my sound. So let me fix that really quick. Okay, thanks for your patience.
I didn't have a lot of confidence towards it. I didn't think I could do it. I really didn't.
When he first latched, you don't know if he's getting anything. It's kind of like, I can't feel it coming out. I don't know if he's getting it.
I worried about my milk supply from the beginning. Before he even came, before I started breastfeeding, when I was pregnant, I was worried about my milk supply. That was the first thing. The first thing that came to mind was, oh my gosh, what if I don't make enough? And what if I can't feed him? What if it disappears? Is it gonna stay long?
I hear people talking like, oh, she should be taking 3 ounces, she should be eating 2 ounces. And I'm like, I don't know how many ounces she's eating. I don't know if I'm giving her enough.
Miley from Wic definitely told me just not to worry, to keep at it no matter what, and even if it gets difficult, that she too had breastfed her children, so she understood what I was going through.
Definitely the wet diapers. So she was going through a lot of wet diapers a day, and they helped me understand the amount of wet diapers she should be going through.
You know, she told me that the more he eats, that the more I would produce, so don't worry about that, and to just keep at it if that's what I really wanted to do.
The peer counselor and my doctor and his pediatrician, we actually worked in a team. We chose formula, and of course that was against everything that I wanted to do starting in this journey, but I needed to feed my baby. But after a month of working with the team and figuring out how to up my supply, we were able to do it. And so now I'm exclusively breastfeeding, and it just feels great.
You're naturally made for this. Your body is made for this. Your child is made for this. And remember, supply and demand. It may be difficult, it may be hard, but you can get through it. And trust me, it is going to be worth it.
Trust your body. Your body will supply what your baby needs. I know they nurse frequently, and in the beginning they do that a lot, and that's going to last a little bit. But just trust your body, trust in yourself. You are doing the right thing for your baby.
So the families that we're supporting all have very similar concerns and doubt of, is this going to work? Is lactation going to work? Am I going to have enough milk? Can I overcome my challenges? And it's, you probably have heard the quote, we can do hard things. It's on mugs and t-shirts, and it's a podcast. But we can't just be that cheerleader for families. We really need to stop and let new parents know that we see them, we hear them, we understand their concerns. So I see your fear and it's big. I also see your courage and it's bigger. We can do hard things. So we can help families recognize that there is hope and there are options and solutions to overcoming their barriers. But we first have to pause and really validate how the parents are feeling so that we can help them really achieve their goals. So what are some of those strategies that we can use to help empower parents to meet their infant feeding goals? When we're making our infant feeding decision, there's a few factors that go into that. So believing it's a good thing to do, that it's valued behavior in our community, and believing that we can achieve it. So we know that, most parents already believe that breast or chest feeding is a good thing to do. It is, there is the breastfeeding promotion work that has been done to really talk up the wonderful benefits of human milk have been successful. And so families do know that breastfeeding is something that is going to provide amazing health benefits for themselves and babies. But it's challenging to do that. And so we already have that key aspect of making the infant feeding decision, accomplished for the most part. Changing the value of a behavior in a community is definitely, a gradual long-term process. And certainly our country is shifting to really valuing lactation. We see that there are more support in our community. We're strengthening our lactation laws for returning to work. We do have changes in valuing lactation in our community. but it's still a work in progress. And the self-efficacy piece, that confidence that you can do this, that you can overcome any challenges and be successful in meeting your breast chest feeding goals. This is really where we can have the biggest impact. This is the modifiable factor to help improve breastfeeding rates. So how do we go about building self-efficacy for families? There's a few key aspects. Previous success or failure. So if this is not a first-time parent, how did it go with their first breastfeeding experience? Were they able to overcome those challenges? Then there's also the vicarious experience through others' success. Having somebody else who has been there, done that, and been successful in achieving their goals and overcoming challenges. That encouragement from influential people in your lives, and the parent's physiologic state. What is their mental health status like? How are they coping with these adjustments? So this is one of the reasons that the peer counselor program is so effective, because peer counselors are serving as that role model, that person who is similar to the family that has overcome these challenges and can be that role model of success for overcoming barriers. They are also that person that is an influential person providing that verbal encouragement and supporting families along their way. A 2017 meta-analysis published in the Journal of Human Lactation found that interventions that focus on building breastfeeding self-efficacy increased breastfeeding rates at 1 and 2 months. And the most successful interventions were focused on education and were delivered in both the hospital and community settings using multiple contexts. So we know that we can't provide all of the education and support families need in one sector. Families need to feel that support and provide the education that's right for them at that time and stage in their lactation journey across sectors. And so it's not surprising that that's where we see the largest impact and the interventions that have the most success. Families need to feel confident that they can find help and that they'll have the support they need when they are facing challenges. So being able to really make an impact with families starts with making a connection. We really need to build a relationship with families so that they can feel like we are honoring where they're coming from, that we respect their goals, and that we're here to support them. So understanding that emotions really drive behaviors. New parents want to feel like good parents, like they're not alone, and that their feelings are normal. We have to incorporate aspects of cultural humility into the care that we provide. Evidence suggests that disparities in breastfeeding exist in part due to institutional racism, biased practices, and implicit bias. So we need to engage in lifelong commitment to learning and self-reflection, really regarding families as the expert and creating mutually beneficial partnerships within communities.
Dealing with diverse culture, again, I need to remind myself to be humble. In the counseling session, I am there to learn from them. Without learning from them, I would never figure out what their needs are.
I like that sentiment of that we are there to learn. We are there to partner with families and learn, and they are the experts in their lives, and we are there to help support. So there are different approaches to lactation support. A study from Australia, so it's a little bit dated now, but in 2013 found that 80% of providers used an approach that considers the provider as the lactation expert, with the top priority of getting milk from the breast to the baby. So really that physical aspect of lactation. How do we get milk from point A to point B? And that the lactation expert was here to kind of help guide that process. Only 9% of the study providers used an approach that viewed the mother as the expert on their baby and their own needs, with the top priority of really helping families establish a close relationship with their new baby. And they view their relationship with the family as an equal partnership. These types of approaches, these family-centered counseling strategies, have been shown to be the most impactful by centering the family. We can build that self-efficacy to empower them to meet their feeding goals. So the Minnesota Wic program has really shifted to family-centered approach. It's called participant-centered services in the Wic program. It's something that I really feel like I wish I had learned more intensively when I first started becoming a lactation consultant and learning how to support families best. It was a very small portion of the initial lactation education that I received, and I really didn't receive a lot of information on this or mentoring on this when I was working in the hospital setting or introduced into the hospital setting. That it was really more of that lactation expert approach rather than partnering with families and using a family-centered approach. So I think it's really valuable that the WIC program has integrated these types of model into all of the care that is provided. So there's a lot of different ways that we can use counseling strategies to connect with families and making sure that we are really keeping that family as the center of the care. So 3-step counseling is the model that is used in the WIC program and the peer program. It's very similar to types of motivational interviewing. So that's the OARS approach in the middle here, when we want to really start with asking open-ended questions, affirming the parent, and then we're going to be providing that education. Shared decision making is another model that really is about building that connection with families, having the partnership and allowing that really back and forth, that we're creating goals and decisions as a unit, as a group, rather than the kind of provider leading the way. When we take time to listen, to target the concerns that families have, we can improve our efficiency by sharing the information that the family is interested in and the information that they're seeking in, so they'll actually be able to retain that information, and it's the information that they're looking for. I think a lot of times especially when I was in the hospital setting, we had there wasn't enough time. There was just never enough time to really provide the care that all of the families needed and deserve. And so in the rush of not having a lot of time, trying to share as much information as possible with families so that you can, make sure they have all of the tools they need for success before they are discharged from the hospital in that short window of time that you have to connect with them. But knowing that that isn't very successful because it's if we share a lot of information that families aren't looking for, they're really not going to retain that information. We haven't paused to really assess what concerns they have, what is most important to them, how can we really validate how they're feeling. And that is certainly the case across all sectors. The lack of time that was mentioned a lot in the breakout room and in the panels this morning of not having the time that we need to spend with families. So we want to make sure that we're making good use of the time that we have by really using counseling strategies that are going to connect with families. So the next video is just a sample of WIC encounters using open-ended questions and affirmations to really guide the conversation.
What's happening? What's going on? What's your main concern?
I've been having a lot of issues with my milk supply and producing milk.
Okay.
So that's a concern of mine.
Okay, yeah, that's definitely a valid concern. We do see a lot of moms that come in that are in similar situations as you, and that's why we're here to help. So it sounds like your main concern is your milk supply and how to find ways to increase your supply and see what's going on. How much are you pumping right now when you're
I pump after feeding him, and usually I pump for 10 minutes on each side or 20 minutes, and I'm only getting about 1 ounce.
So it will be a little bit at a time, and that is normal. But you did mention that you think maybe it's not a right fit for you. So we can help you out and see if we have a flange, the cup that you put on the pump, see if it's a right fit. And if it's not, then we can get you one that might work for you.
Hello, how are you doing?
I'm good, how are you?
I'm good. So please share with me some of your concerns that brought you into the office today.
Well, I found that I'm pregnant.
Okay. So share with me some of your concerns, like be very specific in what you are concerned about.
Well, the biggest thing that concerns me is twice the responsibility, twice the expenses, twice the oh my gosh, what am I gonna do?
Okay. Deep breath?
Yeah.
Okay. So let me say this, you are not the first and you will not be the last to have one baby and then be expecting another. And so we'll get through that, and with my help, knowing that you have my support here at the Wic office if you need to call, you need someone to speak to, and of course, since you're a nursing mom, still, if you need any help with that as well, that's what I'm here for. By the way, I wanted to congratulate you on nursing this little guy for 19 months and considering nursing the new baby and continuing to nurse him once the new baby arrives. You are awesome, mommy. You do a great job.
Hello, my name is Layla. I'm from the Wic Program. How are you today?
I'm good.
Good.
Feeling nauseous.
A little nauseous.
Yeah. Okay.
So this is your second baby you're expecting?
Yes.
Okay. Alrighty. Congratulations.
Thank you.
You're welcome. So do you plan on breastfeeding the newborn?
Yes, I do, but I'm a little bit scared.
Okay. What are some of your fears with breastfeeding the new baby?
Not producing enough milk, and also getting the latch on correctly, because I had latching problems with my daughter.
Okay.
So I want to make sure that everything goes well.
Goes well with the new baby. Awesome. So how did breastfeeding go with your first child?
It was a little bit challenging. I had to do different techniques in order to get her to latch on correctly, because she did give me sore cracked nipples. So I'm trying to avoid that with the second baby. So I don't know whether is it because her mouth was too small or how it is that I can be able to overcome those barriers with the new child.
We do have services here at Wic where we can help you out. So after you give birth, you could even just come on in and we'll help you out if you're still having those same problems with the new baby. So we can have you come in, you sit down with one of our peer counselors or our Wic coordinator, and we can help you out with getting the baby on latching properly so that you don't have those sore cracked nipples this time.
Awesome. And do I have to make an appointment with this, or I could just walk in?
Come on in.
Hey,
okay.
I'm glad to know that.
Of course.
Vicky, good morning. Thank you for coming to your appointment. We appreciate when our clients come to our appointments. That way we can still supporting you and help you and answer any question, any concern you have. I know that you have some concerns. Can you talk about a little bit, or can you tell me what is your concerns, and maybe I can help you today?
Yeah, of course. I've been breastfeeding since she was born, but recently I've had a lower milk supply, and it worries me that she doesn't get full enough, because she'll finish on one and she'll want to latch onto the other, and sometimes I feel like she's still hungry. So that was my main concern, is if I'm not making enough, or if I should supplement with formula.
You don't mind to ask you a few more questions? That way I can, how often do you put the baby to the breast?
Every 2 to 3 hours.
Every 2 or 3 hours. Do you can say that you fed your baby on demand?
Yes.
Or was the baby's demand? Great. Yes. Great, Vicky, because that's what we're supposed to do, breastfeeding the baby on demand. What make you believe that you are not making enough for your baby? Only because baby asked for the other breast? Or what else you can tell me a little bit more why you believe that you don't make enough for the baby. What else?
The only reason I think I'm not making enough is because I was so used to the milk coming out right away when she would latch on, and now it takes a couple seconds up to a minute sometimes, and she gets frustrated, and she, like, I feel like no milk is coming out. And then when she does finally finish on one, she ends up moving to the other. So that's the only reason that I think I'm not making enough.
You're making enough. Okay.
Let me start by asking you, what have you been hearing about breastfeeding?
I hear that it's very, has a lot of vitamins, a lot of nutrients. It's great for my baby. It helps build a strong immune system, and it's free.
Definitely. It sounds like you've done a little bit of research. You're right. Breastfeeding it's free. It's cost efficient. It does definitely have a lot of benefits, a lot of nutrients, vitamins, enzymes, anti-allergies. Has a little bit of everything. It's like the human vaccine, and it's the best thing you can provide to your baby. What do you think about what I just mentioned to you?
Yeah, I'm excited to try it. I'm just a little concerned.
Yeah, what are your concerns?
I'm concerned that I won't have enough milk, and also that it's really time consuming.
Those are very valid concerns, and they're also very common concerns that a lot of our participants have here at WIC. Is it okay if I share a little bit of information with you?
Please, yeah.
Okay, so in order to establish a good milk production, we definitely have to talk about
So I always think it's helpful to just see different ways of asking open-ended questions and affirmations and clarifying information that families are sharing and probing for more information. So we're really having that back and forth conversation and guiding families in getting the answers that they're looking for and the support that they need. We know that the 10 steps, implementing the 10 steps to successful breastfeeding, either through the baby-friendly designation or MDH's breastfeeding friendly birth center recognition program, has a huge impact on breastfeeding outcomes. And really important in our state is that it has been demonstrated to decrease those racial inequities. But hospitals really can't do it alone. There's a short window of time that hospitals are interacting with families, which is one of the main reasons that built into these 10 steps includes aspects across the community. But when we think about the 10 steps, we often really think about the hospital setting, but we want to think about how we can support families to be prepared for that hospital experience and make informed decisions. And prenatally is really the time where families have that mental capacity to think about it and process it and to prepare, so they're not surprised and caught off guard. So step 3 of the 10 steps is providing antenatal care and making sure that families are getting that information prenatally. So the WIC Infant and Toddler Feeding Practices Study 2 found that 71% of women reported receiving breastfeeding information during pregnancy. So nearly 30% did not. So some families are just not even getting information about breastfeeding. We know that primary care providers can make a really huge impact in a short amount of time. So even if they don't have a lot of time or expertise in lactation, just asking about breastfeeding and encouraging it makes a big impact. So women who were encouraged to breastfeed were more than 4 times as likely to initiate breastfeeding as women who did not receive encouragement from their primary care provider. And we know that this impact helps support families where we find the most inequities. So in populations traditionally less likely to breastfeed, provider encouragement significantly increased breastfeeding initiation by more than 3-fold among low-income, young, and less educated women, by nearly 5-fold among Black women, and by nearly 11-fold among single women. So for any providers out there, and then the providers that we connect with, we want to really help them understand the amazing impact of just encouraging breastfeeding can have on the families that they're working with. It's important when we are having prenatal conversations with families that we're really focusing on how we can make breastfeeding work within the context of their lives rather than why it's important. Parents report that they want lactation supporters to be realistic about how hard breastfeeding can be and upfront about the challenges they might face. So I would love if you in the chat box would share your favorite open-ended question or affirmation that you use with families during prenatal conversations. I feel like I get so much out of attending trainings and workshops by learning from what the other participants share, and we can kind of collectively strengthen all of our counseling skills by learning from each other. So I would love for anyone to share their open-ended questions and affirmations. So some examples are, what are your breastfeeding goals? What have you and your healthcare provider already talked about? So really checking in, did their healthcare provider encourage breastfeeding? What information was shared with them already? So we can reinforce, but what other questions and concerns do they have that haven't been addressed? So we can kind of connect that continuum of care from reinforcing information they received and then filling in the gaps for any information that they're still looking for. Affirmations are very impactful in connecting with families. We know that we can really increase receptivity of the information that's shared by using affirmations, because parents are going to be in a calmer state to receive the information and feel supported and connected with us. So your baby is very lucky to have a parent who wants to give them their best. It's great you're asking these questions now. Being prepared makes a big difference in helping you reach your goals. So really affirming the family for seeking out information and for building those connections with you. All right, we need somebody to add something in the chat box. Thanks, Ashley. Have you thought about how you want to feed baby or your babies? Perfect. Yeah, really open-ended. Tell me how you want your breastfeeding journey to go. I love that. I'm looking for you to really be guiding this conversation. How do you want it to go? And tell me more about that. Tell me more is always a great way to help a family just really open up the conversation. Thanks for sharing your suggestions, and keep adding to the chat box as we go if you guys have other thoughts. Some of us are faster typers than others. Thanks, Nikki, for adding. How long are you hoping to breastfeed? So there was a study published in Pediatrics just last month that sampled women participating in WIC, and they found that initiating breastfeeding within 1 hour of birth and giving only breast milk were the steps of the 10 steps that were most positively associated with meeting their intention to be only breastfeeding at 1 month. So we know that all of the 10 steps of successful breastfeeding are impactful, and the more steps a facility implements, the more likely families are to achieve their intended goals. But the step 4 and step 6 have been demonstrated to be some of the most impactful steps. So how can we help families prepare for those stages of the hospital stay and feel empowered to request the support they need to be able to have that golden hour of skin to skin and latching right after delivery? And how can we avoid unnecessary supplementation? And if we do need supplementation, can we implement using donor human milk as that supplement? So from our Minnesota WIC families, there was a study done in pediatrics published in 2020 by Marsha McCoy from our WIC program and Dr. Heggie from Minnesota that demonstrated that for Minnesota WIC families, in-hospital supplementation more than doubled the risk of early weaning. So we can really see that by preventing that unnecessary supplementation when it's not medically indicated can have a dramatic impact on our breastfeeding duration. Thanks for adding in more conversations. So Liz added, what have you heard about breastfeeding? Positive and maybe not so positive. So really opening the family up to share all of their concerns. Mary noted, if they had breastfeeding experience, tell me what your experience was like. So really help them process that. What were the challenges they had? What were the joys? Hannah noted, how do you think you might respond to some of the common difficulties with breastfeeding if they come up? That's great. I love that one for really helping families think about what are ways that they can overcome the challenges that we do know that families already have the answers within them. If we help families process those, they already know the answers. They know what's going to work best for them, but we can help really start that conversation and elicit the ability to process that and feel supported in that. Ashley notes, how can I support you? And then Kathy noted, how did breastfeeding go with your last child? So thanks so much for all this active involvement. It's really helpful to collectively share our experiences and strengths. So when we shift into postpartum conversations, what are some of the open-ended questions that you like to use with families? And what are some of the affirmations that you feel are most impactful when you're having a postpartum counseling conversation with families? Melissa added, tell me what your breastfeeding support looks like. I love that. So what kind of support are they already experiencing? What kind of support are they looking for? Juanita noted, how do you feel breastfeeding is going? And Kathy's added, what is most important today? I love that. Ashley, how are you? Yeah, really, you know, sometimes we're so focused on baby that the lactating parent feels like they're not a part of this and they're not as connected. And so really pausing to, how are you? How is the parent coping? How are things going? Where are their biggest concerns at that moment? And save typing, yeah. Liz noted, how is dad feeling about breastfeeding? Yeah, so those important people in their lives are going to have a big impact on how their breastfeeding goals are going. So partners, parents, who are those important loved ones and friends and family who are going to really be there to support them, and also can, you know, sometimes have a negative impact, and we want to help make sure that we are reaching out and including fathers and other partners in the conversation. Kathy added, letting dad know ways that he can help with breastfeeding. I love that, helping empower partners to be that support person, and where are the active ways that they can really connect. So we know that hospital discharge is a time where a lot of families you know, don't receive the support that they need and can kind of fall through the cracks of our support. So we know that post-discharge follow-up should really take place 1 to 2 days after discharge, and that it really needs a lactation assessment and support during that time. Excuse me. A study published in the most recent issue of Clinical Lactation found that proactively scheduling and providing outreach to support lactating families increased breastfeeding rates at 6 and 12 months. And that made me think about the partnership that was described in Pine County with families discharging from Essentia, Moose Lake, and having those blocks of time for family home visiting nurses to set up a time to follow up with families, and that families don't have to seek out that care during that really overwhelming, vulnerable time, but that care is already established for them. When I wore the hat of the maternal outreach coordinator in the hospital setting, many times our providers only wanted to provide a home care visit for families that were currently having a medical concern in the hospital, and didn't see as much the need sometimes to also provide a home care referral for families that didn't have an immediate lactation or other medical concern at the time. But we know that, with lactogenesis 2 often not happening in the hospital, that our milk is really coming to volume around day 3 to 5. There's so many new challenges that families can encounter during that really vulnerable time of change. So sometimes, related to engorgement, increased nipple discomfort or damage, or delayed onset of a rise in milk volume, delayed onset of lactogenesis 2. And all of those can really lead to poor infant weight gain. So this is a time where families really need that follow-up to make sure that they're on the right track. And so I love the idea of integrating that care from family home visiting, from hospital discharge. And we can see from like the families that I shared about in the beginning, when we were talking about all the barriers that families are receiving, one family might be fine with just that one follow-up visit, but a lot of families need that ongoing support because they have a lot of barriers that they need support addressing there. So we want to make sure families are connected with as many layers of support as possible to really make sure that they are supported across that entire spectrum of their lactation journey. So we know the importance of these warm handoffs and active referrals are going to have for families that often don't reach out to us when they're having concerns because they're already so overwhelmed. So if we can be the ones doing the reaching out, it can make a big impact.
It's just like, okay, I'm just going to get through today. I'm going to get through today. I'm going to get through this time.
You're exhausted. You don't have time sometimes to take care of yourself. I personally forgot that after giving birth, I was recovering. And because you're constantly taking care of the baby and it's always baby, 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 attending to every need of his, that you forget about yourself.
I think sleep deprivation is the biggest challenge that I'm facing as a new mom. And I think what's also challenging is that you're going through it for the first time, so you don't exactly know what you need.
It's definitely I guess, sort of a sacrifice of yourself. One of the best sacrifices I've made, and absolutely worth it. But it's definitely challenging to be the one that the baby depends on.
I definitely reached out to my counselor a lot because the support really wasn't always consistent for me. And when I felt like I needed some advice or I needed a pep talk or whatever it might be, I definitely leaned on the resources that Wic provides. So definitely my counselor, I don't know what I would do without her. I really don't. It was definitely a big help for me in the process.
It made me feel like I mattered. Like I said, sometimes you kind of forget that because right now it's all about the baby. But, they made me feel like I mattered, just through the encouragement and making sure that I was okay.
Honestly, it was kind of hard for me because I'm a pretty independent person and I've always been able to do things on my own and to kind of let go and understand that I can't do this by myself. It really does take a village and you really do need the help of other people.
You've been given a community for a reason, and there are people around you that want to step in.
Enjoy it, because you're going to look back on it and be happy that you spent countless hours with your baby, because you'll never get that time back.
Take it one step at a time. If you're run down, then call somebody or text somebody so that you can get that nap in. You really are run down. If you feel run down, don't try and talk yourself out of it.
It's okay, and it will get better, and it's just enjoy these times. I know that the restless nights and the sleepless nights seem like they're going on forever, but I miss it already, surprisingly. I miss how little he was. I miss, all of those, what seemed to be challenging at the time now is just a memory, and so just enjoy every second that you have because it really does go by fast.
So the stories shared from these moms really are about having that support person who is there when they need them, who they can really know is going to help them explore ways to overcome the challenges that they're experiencing, because we're all going to experience challenges in our lactation journey. It's not easy, but it's worth it. But we need that support team to help us meet our goals. So, really getting to know the lactation support team that's available in your community. This is a time to really help us reestablish those connections. So parent-to-parent support models like the wonderful Wic peer counselors, doulas, baby cafe type models, or other drop-in lactation support, the Leche League, and then important of culturally specific support. So the wonderful Fond du Lac Doula program, those doulas are awesome and wear so many hats to really support families. The Indigenous Breastfeeding Coalition and their perinatal and lactation support circle is available statewide, the Hmong Breastfeeding Coalition. So if you have other great culturally specific support in your community, I invite you to put those links in the chat or the information in the chat so that everybody is aware of the resources in your community, particularly the resources that are really going to be culturally responsive for families. Beth had mentioned work with Cofective to really help bring together all of the players in the lactation support world. We do have services from the Minnesota Department of Health Wic program to help bring together Wic, hospital partners, community partners, and it's exciting to have some of those initiatives kind of ramping back up again after COVID kind of slowed things down. People just really didn't have the capacity to work on these partnerships, but we are back to building those partnerships again and strengthening the existing partnerships. So if you are in a community and you're really looking to build those connections, reach out to us here at the Minnesota Wic program, because we would love to connect with you and get you connected with some of the opportunities for tools and resources to help establish the linkages and to build that support. Now we're going to shift to talking about return to work in school. And so that was touched on a little bit this morning with Holly talking about the worksite program through the Minnesota Department of Health and the updated law, because we know that that's a really impactful time in families, continuing their breastfeeding success.
I've been planning just mentally and physically for returning back to work, but I think throughout my journey, it's just been a day at a time.
I had really bad anxiety about going back to work and about leaving him and what that meant for our breastfeeding journey.
I'll pump the amount of bottles that I know that he'll use, and I'll freeze them.
I think the main thing is just realizing what your baby's schedule is before you go back, and then realizing what your body regulates at and trying to stick to that schedule within reason the best you can. Some days you just have to stretch it a little bit more, but so knowing your places, right? And then if you don't have a space, being willing to advocate for yourself.
So I called Wic and they just let me know how often I should be pumping at work. And again, she printed out the state laws as far as pumping at work and with your job. And then I talked to my manager. It's been working so far. It's been good.
It made me feel like I could do it. Sometimes we try to juggle between, going back to work and making sure that my baby is taken care of. And I was so much more comfortable knowing that I had those things available to me.
I would say to other moms returning to work that you can do it. Your body will provide enough. Talk to Wic about any concerns that you have. They can definitely help you answer any questions.
So the Minnesota Breastfeeding Coalition's 90-day challenge, if you haven't had a chance to check out the resources connected with that project, I do have a list of resources on the next few slides coming up. So there's a link to the Minnesota Breastfeeding Coalition's 90-day challenge page where everyone has contributed all of the great resources across the state. And then as was mentioned earlier, that there's going to be a wrap up of the 90-day challenge next Wednesday, May 11th. So I invite you to connect with the Minnesota Breastfeeding Coalition and participate in that wrap up to kind of hear of all of the resources shared and learn from others, and to celebrate the collaboration of all the coalitions. So, you know, I think one of the main challenges families have with returning to work is, well, first thing, that too many families are going back to work really early. So 25% of American women return to work within just 2 weeks after giving birth. This obviously isn't enough time to really heal and establish lactation. And so families are really in this vulnerable state. And then they also have to talk with their employers about making these accommodations. Unfortunately, a lot of employers aren't as proactive as we would hope they would be about setting up support services for their employees, and the employee really is needing to advocate for themselves. And that can be really hard for a lot of families, depending on their work setting and depending on their relationship with their employer. You know, is English a second language? Are they having a hard time sharing the information with their employer? Are they worried about keeping their job, even though we know it's the law? There unfortunately are sometimes employers that aren't you know, as compliant as we need them to be. So helping empower families to really advocate for themselves and to be there to help advocate for them. I really like a couple of the things shared on the 90-day challenge were like example here, Washington County employees' letter of intent to breastfeed after birth, and to helping the family share that information with their provider, but also coming from that public health perspective. Carries a little more weight for the employer to see that that information is coming from the law and is coming from public health backup. And then the Minnesota Department of Labor and Industry has really been an amazing partner, and they are available to help advocate for families when employers are not in compliant with the law. So encouraging families to reach out and helping them make that connection. We've all talked about, you know, during the breakout rooms and the panel discussions, that everyone is doing amazing work to help families, but we all are struggling to have enough time to do that work. And families also, they need, the impactful work is going to be happening across the sector, across their continuum of time, lactating their little one. And so alone, we can't do it all by ourselves. We really need a community. It takes a village to really support a family in the way that they need. So what can each one of us do independently to support families? And then how can we knit together our efforts to change policy and systems for progressive and sustainable change? I think about the slide that had the barriers that were surrounding the family, and we want the slide that is the support around the family. We want to think about all of the ways that we are going to be really lifting up this family and providing the support that they need to help them reach their goals. So we unfortunately still live in a bottle feeding culture. We don't really have the policies and systems in place to really help families thrive in meeting their infant feeding goals. So we really need to join together to advocate for change, for those large changes that are going to have a big impact on the families that we're supporting. So Kimberly Seals Alliers talks about that women don't breastfeed, cultures do. We need a culture of breastfeeding, not just individual support. We need some of those big changes that are going to have a big impact on the support that families need to be successful, like paid parental leave. There's great work being done at work sites, childcare, health departments, and public spaces to create lactation-friendly spaces. You know, when I'm out at the mall or the museum or the airport and you see the lactation spaces, it's so exciting to see that. But we really need, it shouldn't be exciting anymore to see it. It should just be a given that spaces have those. So we're still, you know, making progress in that area. Having donor milk covered by insurance. continuing to combat predatory formula marketing, and integrating lactation education into medical and nursing school. And the list, goes on of all of the ways that we can help create an environment that's going to support families. So Kim shared about the Minnesota Breastfeeding Coalition. I just want to put another plug in to connect with the coalition. So if you aren't already connected, when you get these slides, there is the link to sign up for the newsletter, attending a representative council meeting. So it's been just since the beginning of the year that the Breastfeeding Coalition has shifted to a representative council. And I would really encourage everyone to join us and share your voice. We want to make sure that the voices providing leadership for the coalition are representative of our diverse community in Minnesota. So we want to really encourage as much participation as possible. So reach out to me if you have a question. The next meeting isn't scheduled yet, but if you sign up for the newsletter, then you'll get notice when that representative council meeting is coming up. Follow us on social media for the Breastfeeding Coalition. They're on Facebook, Instagram, and LinkedIn. Consider applying to be the interim executive director. We are really sad to lose Linda Kopecki's amazing leadership, but she really paved the way for us to be that really impactful, sustainable organization. And so somebody else will be able to pick up where she left off. So if you're interested in the position, or if you know somebody, share that job posting so that we can have that leadership at the state level as well. I've included some prenatal education resources in my handout. So there's some resources here prenatally, and then some postpartum resources. And then some of those return to work or school resources, the Breastfeeding Coalition's 90-day challenge. Information is there. And then continuing education for us as lactation supporters. There's a lot of amazing free education opportunities. So if you haven't had a chance to explore the Continuity of Care Blueprint that was produced by NACCHO and USBC, it's an amazing resource that if you participated in the 90-day challenge, you received a copy of that. It's also available to download. They have 3 of their webinars so far in an 8-part series that have really helped explore that blueprint. And the 4th webinar is coming up shortly at the end of the month. So I encourage you to check that out. The other resource that I think is really great is this Inspire Health Breastfeeding Human Medicine Interprofessional Education module. It's 3 hours of breastfeeding education that really intended for all different providers of care. It's available for free to take the course, but if you want credits, there's a charge, and it does meet the baby-friendly 3 hours of education that's required for providers. So I'd love to open it up for questions.
Thanks, Carrie. Feel free to unmute if you have a question or throw it in the chat.
While we're waiting for questions, I'll just share my next couple slides. So thank you for including me in the summit today. It's really exciting to hear all of the efforts of kind of revamping our lactation support and connections following the pandemic. There's so much amazing work being done in the Northland. You guys really are a model for support. And so we have a lot to learn from the Northland. But please reach out to me if you have any questions at all. I would love to connect in any way. And then here's a couple of my references that will be shared with the slides. And then I'll stop sharing so that if people have questions, we can see each other, which is always nice. And probably everyone's getting hungry, right? We're all thinking about lunch and getting up to stretch after we've been sitting for a while. That it is amazing to be able to connect, virtually, and it just does help a lot of people be able to connect that might not have had the time, but it is harder to really feel connected and to also just sit here this long. So appreciate everybody's willingness.
Yes, agreed. Thanks again, Carrie, and feel free to email her with any questions. Lots of positive comments in the chat. Great presentation and very helpful. So I echo that. Thank you to all the speakers today, sharing really great wisdom with us in education, resources, as well as tangible strategies that we can try right now, tomorrow, whenever. So really appreciate your time. And then also to all the attendees too, as Carrie said, it's a long time to sit virtually. So appreciate your participation and your attention throughout that 3.5 hours. I have a few closing things you'll see in the chat that Yodi posted both the evaluation link and the questionnaire. So the questionnaire is the post-test to be able to get your CERPs and CEUs. So that will be the one you'll need to fill out to get your certificate, but please also fill out the evaluation link. We'll use some of that data as well to help inform some of our regional efforts. We always want to ask questions that are more actionable that we can follow up on, not individually, but as aggregate data in our region, versus just asking questions that are nice to look at the responses and then you don't do anything with. So just want to make sure that you guys know that we do use that feedback to help inform future summits and then the work that we do through Healthy Northland. Those two links will also be on the emails. So in case you have coworkers who had to hop off and are wondering about that, it will be coming in the email with the slides, the other handouts, the breakout session feedback, and that kind of thing. So I think that's all I have. As closing, if you have any questions, we will stay on for a little bit. And it looks like there is a question already. The evaluation link is not working. It sends you to the evaluation as an editor. Okay, well, we'll work on fixing that link. If we don't get it in the chat before we finish today, we'll just make sure you click on the link in the email. We'll make sure that works. We've had a few little glitches with Google Forms lately, so appreciate your patience with the registration, and then we'll get this evaluation link figured out. If you do have any questions and you want to stay on, we will be on until at least noon and can answer anything for you. Otherwise, watch for the follow-up emails, and thanks again for being on today. Have a great rest of your day.